Hi, I will be discussing vegetarian diets for my week 4 video digest. Mediterranean diets are popularly known for no meat, and they are especially known to be taken by Seventh-day Adventists. In 2010, the DGAC said about the vegetarian diet compared to the non-vegetarian diet about weight loss, cardiovascular disease, total mortality in cancer, and it was noted that weight loss was not significantly affected by vegetarian diet compared to the non-vegetarian diet. The same about total mortality in cancer. There hasn't been much studies done to prove that the vegetarian diet helps to improve weight loss or reduce total mortality or cancer risk. However, cardiovascular diseases have been significantly reduced by the vegetarian diet. Besides the meat content for diets with meat or no meat, I believe nut intake as well as fruit, vegetable, and vegetable intake would be the difference between the meat or non-meat diet. The average carbohydrate content of a vegetarian diet would be 56%, and the specific safety concerns about the vegetarian diet would be uh, the content of amino acids in plant protein, which is the basic source of protein for vegetarians compared to the animal protein, which is easier to digest and contains more amino acids that are essential for health. The particular components of a diet that contains meat that may be of a special concern would probably be the saturated fats, nitrites, or iron, which are not very healthy. Talking about the USDA diet, to describe how the USDA diet is overrepresented since 2011 would be my plate, which emphasizes the total eating pattern of an individual compared to the total diet. The two main themes of the DGAC in 2010 were to maintain a caloric balance to achieve and sustain healthy weight, as well as to focus on nutrient-dense foods and beverages. The four things that the DGAC in 2010 especially limit include sodium, solid fats, added sugar, and refined grains. The three greatest sources of saturated fats in the American diet include regular cheese, pizza, and grain-based dessert. The greatest sources of solid fats in the American diet include the grain-based dessert, pizza, and regular cheese. Why the DGAC emphasizes limited solid fats, I believe, is because the solid fats are quite popular amongst American foods, and it's a very high source of calories. And I believe that also because it's a very simple public health message to pass along to the public, to the general population, and I believe it's easier to understand. The greatest source of added sugars in the American diet would be soda and energy drinks. The prescribed limit for sodium by the DGAC is 2300 milligrams for the general population and 1500 milligrams for people who are 51 years old and older. Talking about the AHL lifestyle recommendations, the recommended levels of LDL is below 100. For HDL, there isn't a specific number. However, 50 for men and more than 50 for men and more than 40 for women is considered criteria for metabolic syndrome. Also, for triglycerides, there is no specific goal. However, more than 150 is considered metabolic syndrome. For blood pressure, the goal is 120/80. For blood glucose is less than 100. And physical activity is recommended. 30 minutes of physical activity is recommended per week for healthy people. However, for weight loss, 60 minutes in a week is recommended. To describe the essential components of the 2006 AHA diet and lifestyle recommendations to reduce cardiovascular disease risk, would be overall healthy diet, healthy weight, low LDL, and a significant amount of HDL, a normal BP and blood glucose, as well as a good amount of physical activity and avoidance of smoking. The DASH diet is a good diet that complies with the AHA recommendation for reducing cardiovascular diseases. And the AHA talks about the micronutrient intake on energy balance. And micronutrients are carbohydrate, proteins, and fats. And they say that the micronutrients have very little effect on energy balance, except if it has been manipulated to influence intake and expenditure of energy. Talking about what to eat, to identify and order the 5 foods that have been found to be associated with reduced risk of cardiovascular disease. These foods include nuts, fruits and vegetables, whole grains, legumes, and tea. The main component in tea that helps to reduce the risk of cardiovascular diseases would be the catechins, or the catechins, yeah. And the main component of wine that reduces the uh, risk of cardiovascular disease are the polyphenols. In chocolate, we have polyphenols as well, and the main component especially are the polycaffeines. Talking about something new, I read an article about a study done by E.M.R. Zilowska, and it was about a study amongst the blue zone regions in the world and the effect of vegetarian diet on sperm count among men. It was noted that the lacto-ovo vegetarians had significantly low sperm count compared to the non-vegetarians, who had 69.6 percent sperm compared to the vegetarians who had 50.7. It was also noted that teenage boys had delayed puberty amongst the vegetarians compared to the non-vegetarians. And so I believe this is a very good thing to look into, especially when it comes to issues relating to infertility. And so that's it for me. Thank you for listening.